a fair amount of time when people get diagnosed with disc bulges, or they may have MRIs, and studies done that show disc bulges or herniations, and the question comes up, like, is that something that can get better, basically? And so people ask, well, can that be fixed? Can that be cured? Can that be reversed? And whatnot. So a disc bulge is technically like a degenerative change. And as with a lot of things that are degenerative in nature, degenerative disc, degenerative like arthritis and bone spurs, they're not going to be new again. And so I don't like to use the term cured or fixed. That being said, a good question would be, can it be improved and structurally, and more importantly, can the person feel better, function better, have a better quality of life? But can the actual disc itself like get better? So let's use the analogy of a mattress, and if that mattress is old and gets saggy, kind of like slumped in the middle, is that mattress ever going to be firm again? And the short answer is no. And then it's the longer answer could be, well, what if you like restuff the mattress or something like that, or got new springs? Maybe it could be again. So in the analogy of the disc obviously is not a mattress, but it has a fibrous nature to it, and then it has this kind of gel nature to it in the middle, so to speak. And there is a capacity that the disc can regain hydration and thickness through using what's called spinal disc decompression, but through something that causes a very focused, what's called an imbibition or pumping in the disc that allows the kind of the protein gel stuff in the center of the disc to be able to retain more water, rehydrate, and then the disc would actually look thicker and be healthier. The fibrous part of the disc is never really going to be new again. It doesn't regenerate like skin or something would like that. So the answer is kind of yes and no. It can improve. You can have this rehydration effect on the disc, and it can improve, but it doesn't necessarily heal like other tissues might and look brand new or something like that. So this MRI shows some things that might be classified as disc bulges, and if you were to look at the thickness of this black space here, which is the disc, you can see it's visibly thinner than, say, these other discs here. You can also tell that these discs here are dark, black, and they don't have this kind of silvery center to them. That's where the fluid content, or the water content of the disc, the gel, is higher, and that's more normal. And when the disc is injured, starts to wear, it loses that content, and with time it's going to lose the thickness. Now, what we do to work on or treat or improve these discs is use what's called spinal disc decompression, and that equipment looks something like this here, where you have a person who is wearing some harnesses, connect to a tower. The table has specialized features that allow the force to have a long axis, what's called a decompression force, to separate, and it causes this pumping mechanism in the disc. It actually decreases pressure in the disc, so it causes a centering effect of anything that's bulging. And then there's this pump mechanism that kind of forces fluid or attracts fluid back into the gel of the disc. That mechanism is called imbibition in the disc. This is something that hasn't been studied on large scale, but there have been multiple smaller studies that look at pre and post pain and disc thickness and things like that. What this study is showing is for folks that went through this protocol, before they were treated and after they treated, there was a very consistent improvement in the thickness of the disc. Now, the fibrous part of the disc can't really change, regrow, or anything like that, so that thickness really has to be coming from that rehydration of the disc material through the mechanism I mentioned. And then this shows that people had less pain post-treatment, and what this shows is that people who had a greater improvement in the thickness of the disc on average had more pain reduction. So there's kind of an implied cause and effect in that improvement in the disc height. It's kind of decreasing joint compression and other factors that would then be perceived in the body as pain. So actually restoring that thickness and that hydration content of the disc that does correlate with improvement in the pain. So that's a little bit detailed explanation to can the disc actually heal? Can it repair? Is there permanence to it? Yes and no. There are things that can be improved. There is some permanence to the degeneration of the fibrous ring of the disc, but there are some neat things there non-surgically can be done to kind of draw fluid back into the disc, improve the thickness, improve a person's pain and function.